In healthcare, what do you see as disruptive trends, maybe long term, that if we don't get a handle on these trends in healthcare in Florida, there's going to be serious trouble ahead?
Yeah, well, there are two parts to the question you asked from the way I hear it. One is there's a disruptive trend of obesity that has to be taken apart, and we have to look at what drives it. And I think that's a collaboration of all the stakeholders. And when we talk about stakeholders with obesity, it's not just the insurance company, it's not just the doctor or the hospital. We're talking about the schools, we're talking about the food industry, all of the players that are part of that equation.
You think
need
it's
to
that
come
profound?
together. I think it's that profound, and I think it will crush economically any of the other improvements or changes that happen. So that's one issue. The other side of talking about disruptive innovation is really how do you do things differently? I think we're going to be looking at how do we make healthcare much more convenient. And so one of the trends we will see is that people will be able to have their physician visit on their smartphone. And so it will be convenient to the customer. Think about a typical scenario today. A child in a family has an ear infection twice a year, every year. The mom knows exactly what needs to be done, but she's got to trudge the kid to the physician's office, miss school, be there, go to the pharmacy, wait, get the prescription, when everybody knew what needed to be done. In a new world, you go online, you talk to the physician for a couple of minutes, video to video, you tell the doc what's going on, he looks into the record, sees exactly what needs to be done here, orders the prescription, and on the way to school you pick it up and give the first dose of medication. That's a whole different world, and it actually fits the way we live. That's where we're going, to convenience. That's a system built around the patient, and with all due respect to my doctor friends, and they will tell you this, the previous system was built around the doctor and the hospital, and the new system is going to be built around the consumer.
From educators, I've been hearing about online education. You're talking about online healthcare.
Absolutely.